Assalamualaikum warahmatullahi wabarakatuh. This is the title for our group, Application of Volumetric Analysis in Determination of Aspirin Content in Tablet using Back Titration. This is our group member. It includes of three person, which is Macmikari Smith, Muhammad Nazaruni bin Sharif, and Maximilian Kumundan.
Uh, I start my presentation. I will introduce myself. My name is Chm256. I'm from AS1204E. Today I will present our topic on volumetric analysis, specific in the determination of aspirin content using back titration method. Why is we choose volumetric analysis? Volumetric analysis is a quantitative analytical method used to determine the concentration or amount of substance by measuring the volume of standard solution needed to react completely with it. It is widely used because it's accurate, reliable, and cost-effective. And why we choose aspirin? One important application of volumetric analysis is to determine the amount of aspirin in pharmaceutical table. Aspirin, also known as acetyl salicylic acid or ASA, is commonly used to relieve pain, reduce fever and inflammation, also prevent blood clotting. Therefore, it is important to ensure that each tablet contains correct amount of the active ingredient. Why we choose back titration? Aspirin reacts slowly with sodium hydroxide, so direct titration is not suitable. Instead, we use back titration. In this method, an excess amount of sodium hydroxide is added to react with aspirin. The remaining sodium hydroxide is then titrated with HCl. From this, we can calculate the amount of aspirin in the tablet. In this presentation, we will explain the principle of volumetric analysis, the back titration method, and how it is used to determine the aspirin content for pharmaceutical quality control. That's the intro.
My name is Maximilian Kunandapeni. So next I will explain a little about aspirin. Aspirin, or also known as acetyl salicylic acid, is one of the most commonly used non-steroidal anti-inflammatory drugs, or NSAIDs. So it is mainly used to relieve pain, reduce fever, and decrease inflammation. And beside that, at low doses, aspirin is prescribed to prevent blood clot formation, which help to reduce the risk of heart attacks and stroke. So chemically, aspirin is an ester of salicylic acid. It is only slightly soluble in water but react readily with sodium hydroxide through hydrolysis. And because of this chemical property, back titration is a suitable method to determine the amount of aspirin in pharmaceutical tablets. So this method provides accurate result and help ensure that every tablet contains the correct dosage, which is important for both the effectiveness of the medicine and patient safety.
Hello everyone, we meet again. For the slide number 5, I would like to explain further about the theory of back titration. What is back titration? Back titration is a type of volumetric analysis used when a substance cannot be titrated directly. This usually happens when the reaction is too slow or the endpoint is difficult to detect. Instead of titrating the same directly, we first add a non-excess amount of standard solution. After the reaction is complete, the remaining excess region is titrated with another standard solution. This allows us to calculate how much region react with the sample. And why use back titration? The reason is, in this case of aspirin, direct titration is not suitable because aspirin reacts slowly with sodium hydroxide. The theory of aspirin analysis. First, a non-excess amount of sodium hydroxide, or NaOH, is added to the aspirin sample. The aspirin reacts with part of the NaOH through hydrolysis. Since the extra NaOH was added, some of it remains unreacted. Next, the remaining of NaOH is titrated with standard hydrochloric using phenolphthalein, or known as PHP, as the indicator. By knowing how much NaOH was added at the beginning and how much remained after the reaction, we can calculate how much NaOH react with aspirin. From this value, we determine the amount of aspirin in the tablet. For the chemical reaction, first reaction is hydrolysis. The first reaction The first equation shows aspirin react with sodium hydroxide. During this reaction, aspirin is converted into sodium salicylate and sodium acetate. For the second reaction, or known as back titration, the second equation shows the excess sodium hydroxide reacting with hydrochloric acid. This is a neutralization action that produces sodium chloride, and the byproduct is water. In the summary, back titration allows us to accurately determine the aspirin content by measuring the excess sodium hydroxide. They did not react. Thank you. Okay, hi, we meet again. This slide is about methodology. This slide shows the methodology used to determine the aspirin content by using the back titration method. For the first step is crush and weight the aspirin tablet. First, the aspirin is crushed into a fine powder and a correct mass is wet. Crushing the tablet increases the surface area, allowing it to react more completely with the sodium hydroxide. For the second step is add excess sodium hydroxide or NaOH. Next, a non-excess volume of standard sodium hydroxide solution is added to the powder aspirin. We use an excess amount to ensure that all the aspirin react completely. The third step is we need to heat the mixture. The mixture is then heated gently to speed up and complete the hydrolysis reaction between aspirin and NaOH. Step 4 is allow the solution to cool. After heating, the solution is need to cool down in room temperature before titration occur. This have obtained a more accurate titration result. For the step 5 is add PHP or phenolphthalein indicator. A few drops of phenolphthalein indicator are added. The solution is pink because excess sodium hydroxide is still present. Step 6 is titrate the HCl. The excess sodium hydroxide is then titrated with standard HCl from the burette. Step 7 is determine the endpoint. The endpoint is reached when the pink color just disappear and become colorless. This indicate or show that all the excess NaOH has react with HCl. For the last step is calculate the aspirin content. Finally, we calculate amount of sodium hydroxide that react with aspirin by subtracting the excess NaOH from the total amount that was added. From this value, then aspirin content in the tablet can be determined. In summary, this method allows us to accurately determine the amount of aspirin a tablet by measuring the excess sodium hydroxide after the reaction. Thank you.
This is for my part, which is example result. This is the example of the result. The average of aspirin content was 500 milligram per tablet. The measured value matched the manufacturer label claim. This indicates that the tablets meet quality control requirement and contain the correct amount of effective ingredient active ingredient. The second one is the importance of aspirin. One of it was relieves pain by reducing mild to moderate pain such as headache, toothache, muscle pain, and menstrual cramps. Reduce fever, making it useful for treating illness associated with high body temperature. Act as an anti-inflammatory agent, helping to reduce swelling and inflammation in conditions such as arthritis. Prevent blood clot formation at low dose, reducing the risk of heart attack and ischemic stroke in high-risk patients. Improve patient safety and treatment effectiveness by ensuring the correct dosage is present in each tablet through quality control testing. Widely used in pharmaceutical and clinical practice because it is effective, affordable, and readily available. And the last one is essential in pharmaceutical quality control, where accurate determination of aspirin content ensure that tablets meet pharmacopoeial standard for quality, safety, and efficiency.
Now, I will discuss the advantages and limitations of using back titration to determine aspirin content. So, first, the advantages. Back titration is suitable for analyzing aspirin because its reaction with sodium hydroxide is relatively slow. So this method provides more accurate and reliable result than direct titrations. So it is also simple, cost effective, and also require common laboratory equipment, making it practical for routine analysis. So in addition, back titration improve the accuracy of determining the active ingredient in pharmaceutical tablets and can also be used for samples that dissolve slowly or react slowly. So however, there are some limitations. So this method requires careful measurement of both the excess sodium hydroxide and the titrant. Any small error can affect the final result. So it is also more time consuming than direct titration because it involves additional experimental steps. So furthermore, error may occur if the aspirin does not react completely with sodium hydroxide. So another limitation is that sodium hydroxide can absorb carbon dioxide from the air, changing its concentration and reducing accuracy. So finally, other acidic or alkaline substances present in the tablet formulation may interfere with the result if they are not properly considered. So overall, although back titration has a few limitations, it remains a reliable and widely used method for determining aspirin content in pharmaceutical tablets. So now I would like to conclude our presentation. So in conclusion, back titration is an effective and reliable volumetric analysis method for determining the aspirin content in pharmaceutical tablets. So it is especially suitable because aspirin reacts slowly with sodium hydroxide, making direct titration less accurate. So by adding an excess amount of sodium hydroxide and then titrating the remaining sodium hydroxide with hydrochloric acid, so the amount of aspirin can be determined accurately. And this method is widely used in pharmaceutical lab because it provides precise and dependable result. So overall, understanding the principle, methodology, advantages, and limitation of back titration help us to appreciate its importance in pharmaceutical analysis. And accurate aspiration determined is essential to ensure the quality, safety, and effectiveness of medicines before they reach patient. So, thank you for your attention. We hope this presentation has helped you understand the application of volumetric analysis in determining the aspirin content. We are now happy to answer any question. So, thank you.